changed the conversation from the reactive model of care to actually a discussion around risk reduction and prevention. So we are empowering that discussion in a different way with a patient and helping the dentists that maybe are not confident or experienced enough maybe in that discussion even to say, hey, here's a platform to create the conversation.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao. I hope you're having a fabulous day, week, year, whenever you're listening to this podcast. I want to thank the sponsors, both Dental Intelligence and the doc sites, for their support. Today's episode is called The Power of Intelligence, AI for Precision Care and Improved Patient Acceptance. My guest, I met at the DICMA meeting in July. We ran into each other. We actually were basically introduced by a mutual friend of ours. We met, we spoke. I felt he would be a perfect person to have on this podcast. He has a new product that's coming out, or that it was just released and is now available for users. So I wanted to really introduce more of the product and what they can do for the industry. So I'm really excited today to have Amreesh Khanna from OraQ AI as my guest. Welcome to the Raving Patients Podcast, Amreesh.
Thank you so much, Len. Yeah, it was a pleasure meeting you back in the summer, and really excited to be here today. And it's been an awesome time getting to know you and hear about all the cool things that you've been up to. So a pleasure to be on here because I've been listening to your podcast for a long, long time. So thank you.
Well, I appreciate that. And I know you had mentioned that to me when we met, that you do listen to the podcast. So I'm glad I was able to have you on here. So Dr. Amreesh Khanna is a dentist and entrepreneur driving innovation in dental care. With a passion for artificial intelligence and machine learning in clinical applications, he leads OraQ AI, a startup he founded that is revolutionizing ethical dental practice growth and patient care. With 15 plus years of clinical experience, co-owned 2 practices, Dr. Khanna specializes in complex patient care, including dental implants, gum grafting, sedation, and dental sleep medicine. He's also an adjunct assistant professor at the University of Alberta Faculty of Medicine and Dentistry and runs ADEPT, Dental Education, Empowering Dental Professionals. Dr. Khanna's community involvement includes founding the Shine Dental Clinic and Cause to Shine, providing dental care to those in need. Beyond work, he enjoys traveling with his wife and 2 daughters, creating lifelong memories. With his visionary approach, Dr. Khanna is shaping the future of dentistry. So, speaking of the future of dentistry, why don't you jump right in? Let's tell people what OraQ is all about.
Yeah, absolutely. Thank you. So what we have developed and built here at OraQ AI is we're looking at how do we really redefine dentistry and how we look at patients, right? I think the problem that I saw through my days in clinical practice, owning 2 locations, multiple dentists, is that every time we walk in to see a patient, we look at them with our own filters, right? We all come in knowing, where we trained, how many years we've been in practice, what we love doing, our areas of interest. And, our hygienist will say, hey, I know when one doc walks in, they're looking at, 5 things. Another doc walks in, they're looking at 2. So ultimately, that was causing a problem for scalability and growth within my own practices to say, hey, well, that's not good because one, we're leaving opportunities of care on the table that's costing the business money. And 2, patients deserve better, right? We need to really find a way to give a better, consistent patient experience so that, they can really say, hey, like they don't want to say, well, why did last time I was in for a recall, Dr. So-and-so told me this, and then now I'm here, now you're telling me something else. And the good old verbiage that is my dentist selling me on something I don't need, right? So how do we solve that problem? So what we built here at OraQ is a system that harnesses the power of AI and digital automation and workflow automation to say, how do we look at the data differently, drive and empower precision care real time so that dentists can feel confident around the care and the treatment plan that they're providing so that they know they are giving the optimal plan to the patient. But ultimately, the biggest issue, as we all know, is when you're in that world yourself too, Len, is that, hey, we got to get patients to say yes, right? And we need them to say yes to the treatment and value the treatment that we're recommending. And if that's the only way we're going to get butts in the seats per se and actually start growing our practice. So we do that by giving full transparency and control and ownership of oral health data right back in the hands of patients so that they get to see an overall wellness profile, areas green, yellow, red, and change the conversation so they can say, hey, okay, now I understand why maybe my dentist is recommending me that crown on that tooth that I had an MODBL on and it was sitting there for the past 10 years and nobody told me anything about it, right? So that's what we really do to increase case acceptance. So it's the big things there, empowering precision care. through real-time technology support and helping patients say yes to the right treatment.
That's awesome. And I know you've had an initial great opening into the industry. I know a lot of people have been talking about it. So let's start off with the content part of this. And really, I'm curious, I'm a dentist as well. I was not involved in AI. I got involved in reviews. But talk about your journey as a dentist and that led to you exploring and getting involved in AI, because I know that's one of your passions is artificial intelligence, amongst other things.
Yeah, thank you. I'll share a little bit of my journey. As you mentioned in my bio, I graduated from University of Alberta up in Canada. Had a big passion for the surgical side of dentistry at that time in my post graduating dental school days. I was do I want to specialize? What do I want to do? Like many of us are considering that question. So I did a residency program for a year out at Montefiore Medical Center, Albert Einstein College of Medicine in New York. Came back to Calgary, and my mentors said, hey, you know what, go back, start practicing. You can do a lot of the stuff you love, because Calgary wasn't a big saturated center. So I started working at different locations, doing, in a way, the stuff that the practice didn't want to do. So, I was the guy who said, okay, send it to Amreesh. He'll sedate him. He'll do this. He'll do that. So started really seeing a lot more complex care and patients with dental anxiety, patients having a lot of needs and combination of needs, whether it be occlusion, a surgery, dental sleep medicine, a whole array of stuff. And so I did that for about 5 years. Met my wife, who also was a dentist through that journey, and then my brother was also a dentist graduating too. So we all came together and said, "Hey, let's get our dabble our feet into entrepreneurship and buy our first location." So in 2012, bought our first practice from a retiring dentist. And then a year later, woke up to a phone call from a friend at 5 in the morning one June saying, you got to look outside your condo building here in downtown Calgary to literally see the roads in front of my building in downtown like becoming a river. And what happened was we got hit with Calgary got hit with 100-year flood, which was this freak event that literally started flooding the city. And our dental practice was 4 blocks away from where I lived. So we rushed over there, literally seeing, water pouring in and, the chairs washing away before our eyes. And there goes my $1 million investment a year later. So it was, I share that because for me, that was really the start of my true journey as an entrepreneur, I think as a dental entrepreneur, because you had to see an investment kind of watch away and then figure out how the heck am I going to rebuild this thing, secure the investment, and take care of all the patients again and so on. So that's really when I started learning about how do I really run a dental business effectively? How do we drive high value, high impact care? Lucky to say, fast forward a couple of years later, we were able to more than double the value of that location. Said, hey, you know what? I think we're onto something. Let's get another location, right? And so got another location, and then soon after that, we all got hit with the pandemic. And so I jokingly would always say at that time that it wasn't my first closure. And so that's with my Adept dental education platform. That's when I really tried to support a lot of dentists through that time around saying, hey, we can look at this not as a crisis, but an opportunity again and come out of this better rather than, being stuck in the survival mode that we were so, ingrained to be in. But that's when the journey for me with AI really started, because I was at 2 locations and seeing how I was sharing that story with you before about, why am I hearing these stories from my team that, one of us is looking at patients in one way and one's looking at it in another, and started diving into, okay, was this just a me problem? Or, were colleagues sharing the same issues as well? And how are we solving it? And so started looking at other docs, and they're all saying, yeah, we struggle, right? Sometimes I've got a new grad, I've got another grad trained somewhere else, I've got another doc that's maybe been out for 25 years, and we're all looking at patients a bit different. And the only way we're solving it is continuing ed and mentorship. So the problem, as we all hear when we go to these courses, is what do we do Monday morning, right? We come back to a busy day. We've got a hygienist that's sick, maybe an assistant that gave notice, bills to pay, and a full day of schedule. And how do we put on all that great stuff that we learned over the weekend into practice? So the implementation was the problem. So I started diving into, okay, could we really leverage artificial intelligence, machine learning to kind of help with this problem? And so did a research study through the University of Alberta, worked with Alberta Machine Intelligence Institute, a big AI hub in Western Canada on technology validation, and then said, okay, I got the check boxes from the market, the technology and the clinical side. think I'm onto something here and jumped into creating the company here in 2021.
That's an amazing journey. I mean, look, there's always a reason behind why you build something, and I obviously realized how important reviews were to the industry, and nobody was doing it well back then, and I took it upon myself to change the industry, and it really has. iSocial reviews and then Bird Eye has really impacted the industry. But there was a reason why I did it. Obviously, there was a reason why you went into this part of your now career. As you told me, you're not working as much in the dental practice anymore. I know you specialize or love doing the surgical part, but your main focus is now building this business. So again, a lot of similar parallels between and I told you I was 40, you're 40 years old. So again, when I started, I was 40 years old, as I mentioned. So a lot of parallels there. So I wanted to bring up something as we move through this, I think is really, really important. People are going to hear and they're going to see and read about AI again. And they only really, think about AI as more as imaging. And I know that AI is way more than imaging. So can you, really talk about, where you see the AI in the industry going and how everybody can kind of work together here? It doesn't just have to be about imaging and everything else. So can you give me your thoughts on that?
Yeah, absolutely. And yeah, I know it is very cool when you shared with me your journey as well, Tila, because I feel like I got lots to learn from you and following in your footsteps 10 years behind, right? But it's been a fun journey, and I think when it comes to AI and technology and innovation, 2023 I think was a big year for whether it was the dental industry or whether it was just AI in general, because I think the big propellant there was the introduction of ChatGPT, right? And we started hearing about AI everywhere. So it wasn't just in the industry. We're hearing about it in the industry through the amazing companies out there that are doing great things with imaging AI, X-ray analysis, CBCT analysis, and that kind of thing. So to just talk about the different direction for a moment that we took through OraQ was, I looked at it and said, hey, though imaging I think is extremely important, we can't live without it in our day to day. What about everything else that we look at? Like what about that? Are we looking at, the muscle, the joint, the medical history, the oral systemic connection? Are we looking at that wear pattern? How do I make sense of all this stuff, right? And this is the problem that is hard for the human mind to process. So when I teach and talk about like how do we think on like an AI dentist today, even if you don't have this technology, it's really about like how do we look at the data differently, right? And it starts with, you have to look at the right data to be able to see the possibilities, right? And if we don't look at the right data and we're looking at only 5 things when we should be looking at 10, well, how can we open up our eyes to the possibilities of care with our patient? So that's kind of the I think the journey that when we talk about AI and innovation in this space in dentistry, everything is data, right? And so we have to start with looking at the right data first, and that's where OraQ focuses on everything outside the imaging side to say, okay, let's look at medical and dental histories. Let's understand communication preferences as patient, understanding where are they in their journey of wanting the right dentistry today. Maybe they're not there right now. How can we help a clinical team member or dentist know that even before they walk into that operatory with that patient? And then guide a consistent data collection. So it doesn't matter if your assistant has been with you for 5 days or 5 years. It doesn't matter if you're a new grad dentist or a seasoned doc, right? We're all looking at the patient with the same way, but it's all about rolling that up into a quick and easy way to understand it. So what we do through OraQ is we look at a risk and recommendation profile. So you get 7 key areas and you're going to see, okay, in one quick view, I can see where does my patient sit on medical risk or sleep disorder breathing or occlusion. So we're looking at what we've done is try to create that central platform to be able to say, okay, there's all these other amazing technologies out there, but let's roll it up into a quick and easy way. Because imagine if a patient came to your practice tomorrow and they moved cities and they were with one dentist for the past 20 years. We always start over with that patient, right? And we never really know anything about their history or anything. Even if the previous dentist decided to share it, we don't have the time to look through tons of records and stuff like that. But if I could look at one view in an OraQ wellness profile and say, hey, I can see it. Was this patient getting healthier or declining in health and where? It's going to shape how I treat that patient and look at that patient differently from day one. So that's the power in the data. In terms of collaboration and where the industry is going, I think there's, again, amazing things being done, like as you mentioned, in AI and so many other aspects, whether it's patient engagement, it's reviews, it's helping administrative team book patients better. It's looking at the revenue cycle management side of things. There's a whole array of things here. but I truly believe we have to be connected, right? The hard part for companies like myself today is the connections with our practice management systems, right? That's where the data is held. We all want to integrate with it, but then we also got to all integrate with each other. So now you've got an intraoral scanner, you're taking your iTero scan, you got a CBCT, maybe you're using one of the AI imaging companies out there, so you've got analysis coming from there, and now you're using OraQ, and it's giving you all this stuff. Well, you've got lots of systems, but then if we could put all that together in one way, wouldn't that be amazing? And I think, everybody's starting to open up their eyes to the fact that we need this data interoperability and data sharing and open architecture, because closing it down, I don't think is going to keep the big companies owning the market share going forward, right? And I mean, they know that, well, if I can keep it open and let people communicate in that way, well, we're going to have better outcomes. We're all serving the same end user. We're all serving the dentist, right? So how do we make that process better?
I think that's 100% correct. Where do you see, or how do you see these companies in the AI space, basically figuring out a way to kind of become interoperable where they can all function within I mean, obviously you have to have open architecture, like you said, or it's never going to happen. An example I would use is if you remember the very, very first iPhone that came out in 2007, the iPhone 1 was closed architecture. Everything, there was no apps or anything. It was just that there was that phone and there was those things they had on there. Once they opened it up, that product became, everybody has one in their hand now. So, how do you see that happening in the dental industry?
Yeah, I think it'll come from need and adoption from the users, right? So now that users are using technologies like ours, technologies like the imaging companies, all the other companies out there, like the back end analytics, the front end CRM side of things, they're using all of these things, and it's us as dentists who are going to say, hey, well, I need all these things to talk to one another, and I ultimately need them to talk to my practice management software. So, I do see, even in our discussions with practice management softwares now, that they're opening up their eyes to say, okay, well, if we don't run with this, we're going to be left behind, right? And I know especially the systems that are earlier or maybe are not as big as the big ones out there today are more open to this and trying to jump on that already, because they know that differentiates them from the rest in the space too, right? So that's one piece. I think, the more dentists adopt these types of technologies, the more they're going to be asking for, hey, I need this to talk to this, right? And I think from our vision in OraQ, it's really about how do we create a central platform. Like, we're not trying to be a practice management system, but I want to be a central hub that can take in that information. You get that radiology report from a CBCT. Well, right now, today, I have to read that and I have to do something with it and still combine it with all the other patient information I gathered, right? What if that could feed a central hub of an overall analysis, again, on a risk index and profile in this patient? What about salivary testing? You've got genomics, phenotyping, you name it, right? There's so much stuff happening. But if we can roll that up into one central space, now we've made the process more efficient for dentists, right? And so that's where I think, all the companies that are doing that know we need to be talking with one another. And that's what we're very open to, and always welcoming, the relationships out there with amazing companies that are doing this stuff in the space to say, hey, let's be connected. Because if we're connected, now the practice management softwares, the EMRs are going to say, well, we need to be connected to you.
Yeah. I think once somebody starts to do it, I think that everything will trickle down the road. It's just that you have to get together and figure it out, because I think that's how the companies are going to get even bigger. If you make it where everything kind of communicates with each other and you have one hub for everything, is basically what I'm talking about. So,
Yes.
So I'm curious, I am a huge fan of case acceptance. I talk about case acceptance. I've given seminars on it, for many years because my case acceptance was so high. So I'm curious where you see the role in your product taking case acceptance to the next level.
Yeah, absolutely. And I agree with what you said 100%. The value in it, because that's ultimately what grows our practice, right? And lets us do the dentistry we love. So then we're doing the fun cases and stuff because patients value it. And so with our product, what we found again was there was two elements of that feed the case acceptance pipeline, call it. One was, let's first fill the bucket of treatment, right? Let's do that the right way, because if we're only looking at the low hanging fruit, we have to rely on volume to really be able to fill that bucket. So we need a lot of patients coming in the door, a lot of marketing dollars, all those kind of things to fill the bucket of the low hanging fruit items, right? So what about all the rest of the stuff that was being left on the table? So first and foremost, what we do is our system now guides a dentist real time. Once they've put in the data into OraQ, all the information from OraQ will go right back into the practice management software after. So there's no like redundancy on the notes and things like that. But we're able to process that data now and say, hey, doc, imagine if you had your favorite mentor on your shoulder. We call it the mind and the wisdom of 1,000 dentists. They would say, hey, by the way, I know you pointed out those cavities that, okay, you think this patient needs to come in 6 months for hygiene, but what about that wear pattern? And oh, what about the fact that maybe instead of giving them just a night guard tomorrow, does this patient need to be ruled out for obstructive sleep apnea? And by the way, they've got this medication, these conditions from a medical history perspective. So it actually makes sense to bump this patient up to a 4-month hygiene interval. And let's get this recall regimen going. Here's a caries protocol for prevention. We give all that right there and then. So now the dentist can look at all that and say, okay, now I've got that sort of wisdom coming to me. What do I want to plan now? So ultimately, dentist is still in control, but now they've actually filled the pot with the optimal ideal care. Give that plan now and flip it back to the patient. So the second piece was we found transparency and ownership of data was the big piece. So change the conversation from the reactive model of care, which is you've got these problems, this is what we need to do to fix it, to actually a discussion around risk reduction and prevention. So when we sit a patient up, they see these little risk dials in green, yellow, and red. The conversation changes immediately because now we're not saying you need a crown on that tooth with a big filling. We're saying, hey, your bite risk is this, your biomechanical risk due to cracks and wear in your teeth is this. So my suggestion to you is I think we should do something about this now, right? Because you have a higher risk in these areas. Totally up to you if you want to watch it, but here's the potential consequences of leaving it, right? So we are empowering that discussion in a different way with a patient and helping the dentists that maybe are not confident or experienced enough maybe in that discussion even to say, hey, here's a platform to create the conversation. And then patients walking away with that right on their device right after has been the key, where patients are now like, holy, I got my photos and x-rays and this dial and my treatment plan like right in front of me. That's what's changed the conversation for us. And when we have tested this and seen the results on it, we increased case acceptance from the industry average of kind of that 30-40%, almost up to 70% there. So that was huge with what we found.
Wow, that's really impressive. I mean, I love hearing that you bring it up 30+% by systematizing everything and making it really easy and really showing the patient what they need and why they need it and what the consequence of them doing it. They don't see value, they're not going to buy it. This obviously creates value for them. So I definitely understand that. Where do you see the future of things going? I'm curious, obviously you're a new company, you're a startup. Where do you see things 5, 7, 10 years down the road from what you want to kind of do to the industry?
I think, again, it comes back to ultimately how do we drive better care for our patients and drive a better patient experience, right? I truly believe we don't need to have hundreds of patients walking in the door necessarily every day to be successful. If we have it, that just allows us to grow our practice and bring more docs in. But when we take the time, do what's right for our patient, ultimately they're the ones writing the good reviews. They're the ones sending us more patients, and we have a thriving, wonderful practice that we can feel proud of. So how do we, again, leverage all the innovation, the technology to help us do what we do better? If we can walk into an operatory tomorrow and already we have information given to us in a way that is meaningful rather than us having to collect the data and derive meaning from it. That's what the future that I see here. And what we're really working to build here with OraQ is that walk in the door, sitting down with the operatory, I've already got information coming from an X-ray. I've got information coming from a CBCT, an intraoral scan. I open up OraQ and I talk to Q and say, "Hey Q, let's start the exam on Len here." And Q's now guiding me through an AI-driven exam because it knows based on the data we've already even collected from medical histories, all these other areas, what do I even need to look at in you? Because what I need to look at in you might be different than what I need to look at in Mary, the next patient, or Joe, the next patient after that. So it's never going to replace us, right? But if it can give us the meaning so we can make a better decision around care quicker, faster, and remove the bias that we bring just as humans, that's I think the future of where we're going. And that's where I think patients are going to want it and ask for it. They're already looking for it because they're tracking their metrics from whether it be an Aura ring or their steps from a Fitbit. And so like they want to be in control and see how technology is guiding that process versus it just being left to kind of that one mind.
Got it. Sounds really great. I'm a huge fan of artificial intelligence. Bird Eye just is incorporating AI into its platform a significant amount. It's becoming an AI platform almost 100% soon. So I'm really excited to see where things go. Before we switch to the Q&A part of the lightning round part of the podcast, is there any other than which we'll get your contact information at the end, anything else you wanted to cover before we switch to the Q&A?
No, I think this is awesome. Really appreciate the conversation and everything. I'm really excited to. I'm always looking to talk to dentists interested in this kind of thing, collaborating with other, great innovators out there who are doing wonderful things in the space. Because again, the power in all of us working together, I think, far exceeds any one of us alone, right? So, and we can really change the face of what we do as dentists and make everything better. So, yeah, I welcome that, and thank you again for the opportunity to be here. Yeah.
All right. Well, that's great. So let me switch to this Q&A. For those that haven't listened to an episode yet, I do this every episode. I ask 8 to 10 questions. They're very quick business related questions. The guest has to just answer them with the best of his abilities. So first question, who do you look to for advice or mentorship?
I have great coaches and mentors in my life that I've always used. So I've been part of different coaching and mentoring things even before my days through a startup. So for me, I call that my own little personal advisory board and it includes close friends of mine, right? That I can get honest, brutal facts.
That's good. That's good. Second question, how do you define success?
Success to me, I think, is waking up in the morning and doing what drives you, fuels you, and what you love, right? And if you're doing something that gives you that and fuels that inner purpose, I think that's success. It's not about how much money you're making or what you're doing. That's ultimately success to me.
Got it. If you could be trained in any one thing by a top professional, what would you choose?
Maybe learn to fly.
That's cool. All right. What kind of culture exists in your organization and how did you establish it?
For us, I mean, being an innovative company, of course, we always say innovation is a big part of our culture, but agility is a big one. And we have one of our core values is gracefully agile. And I think as a startup to create that in our culture, it's about knowing how things are constantly changing and embracing the change. And even I had to embrace that concept coming into this world. So if we can do that gracefully, we can change, we can adapt, and we can keep working hard towards it versus being bogged down by change.
Got it. Okay. Do you keep a journal and does it help you?
I do keep a journal and it does help me tremendously. Sometimes it's just on the personal side where I have to brain dump all the crazy things up in my head here. And other times it's just about kind of planning and seeing the vision ahead of me of what am I trying to build and putting it on paper.
Got it. How do you generate new ideas?
The newest ideas for me come when I have a period of calm. And so, it's funny. I'm sure like a lot of busy people like yourself, Len, when I get a vacation, my mind doesn't stop going, but it actually is the clearest time when all of a sudden I'm like, whoa, I've got this and I need to, again, journal it or write it down so I don't forget it.
Gotcha. What have you learned from the most successful person you know?
I think the constant belief in something that you want to do and that you will be able to figure it out. Like if you truly believe in where you're going, I think, the universe kind of puts the right people on your path. And as long as you keep pushing in the right direction with the right intention, you will find a way forward. So that's something, my dad always taught me about that hard work is something that never goes waste. And you just keep working hard. You'll find the answers along the way. Right.
Got it. What profession do you feel is the most undervalued today?
I think customer service. I know that goes to everything in so many industries, but I think in the post COVID pandemic era, customer service dropped a lot, and like whether it be in the hospitality or restaurant industry or whatever. But people were going through a lot. But when you see the people who are actually taking the time to make your day a tad bit better, whether it's serving you a coffee or something, how can we appreciate these people because they're doing something to put a smile on our face?
Got it. When did you know that you wanted to take an entrepreneurial path in your life?
I knew that, I think, from a young age. I never knew what that was going to look like. But my dad, again, was a big mentor of mine who always talked about, and he had ideas and he was very entrepreneurial himself, though he had his main day job was an engineer. But even in my early days in elementary school, I used to, I don't know if you remember those creepy crawler machines that you can make those jelly little things.
Yes. Yep.
So I had a friend that me and him would make it, and then I somehow would go sell them for 5 cents at recess on the playground, and that gave me enough money to buy my family a Christmas present that year. So I knew there was some itch that I had to do something and sell something, but never knew what it was going to lead me to where I am today.
Awesome. When you were a child or a kid, what was the first thing you wanted to be when you grew up?
I wanted to be a professional soccer player.
Nice.
So I love soccer. That was a huge part of my life through all my childhood years. And so aspiring to play in the FIFA World Cup was always a dream.
That's great. I love that. And last question, I ask everybody this question. If you had one subscription you could not live without, either professionally or business, what would it be?
I think LinkedIn on the business side, just because it's opened up so many doors for me in terms of just connecting with people, seeing what's happening out there in the business and the innovation world, and connecting with people that sometimes I never. How else would you connect with them? Sometimes just reaching out and saying hello, and somebody says hello back, right? So that's been a huge thing that opened up my ability to connect with people that I never would have otherwise found a way to do so.
That's awesome. That's awesome. LinkedIn, that's the first time I've heard LinkedIn. It's usually like Netflix or Salesforce or something like that. But I think LinkedIn's a great subscription to have. So, well, that was awesome. You answered those really, really well. Thank you so much. I want to know how people can reach out to you for more information about OraQ. If they want to get a demo of it, if they want to learn more, what's the best way for them to do it?
Yeah, best way is to go to our website, oraq.ai. So that's oraq.ai. And reach out right on our website to learn more. Be sure if you reach out to say, hey, you heard about it from the Raving Fans podcast. We'd love to take care of your listeners, Len. And, we're going to be at various different conventions and everything through the year here. Probably the most closest one coming up would be Chicago Midwinter. So please do come visit us, say hi. We'd love to show you what we're doing. And yeah, you can find us on LinkedIn, of course, so you can reach out to me there, and even Instagram as well, too.
Got it. Thank you so much for joining me today. I really appreciated your insight and really informing the conversation regarding what OraQ is and how it can help the industry. So guys, if you like this episode, please share it. Please tell your colleagues about it. Please tell your colleagues about OraQ and have them reach out to Amreesh as well, so we can help him grow his business. So as I say on all of my podcast episodes, as I end it, remember, your reputation matters. Until the next episode, Amreesh, thank you so much for joining me, and we'll talk to everyone soon.
Thank you so much, Len. Thank you, everybody.